Okay, hi everyone. My name is Charlie. Welcome to the Coalition for Global Health Innovation. I want to do a quick introduction about our organization. So we are a registered nonprofit organization. We are a group of young professionals and students in global health and international development. We are from many different continents. What we do is that we publish articles talking about global health, equity, inclusion, and we also organize online events and seminars. And we also have our CGHI Action Tank, where we facilitate and help young professionals and students to build their projects with our peer mentorship. So we're a community that help young professionals to empower ourselves. So I would love to invite everyone to follow us on Instagram, LinkedIn, connect with us, check out our website. And if you would like to write an article, if you are looking for a co-author, let us know. If you would like to, join our Young Professional series, feel free to reach out to us. We will share our contacts in the chat. So I thought maybe we could start with a quick energizer and everyone could get familiar with each other. So we could do a 1-2 minute self-introduction. I'll start. So like I said, my name is Charlie. I'm the president of CGHI. I am Chinese. I'm currently doing my master's in development studies at the University of Cape Town. I'm joining from South Africa. It's 5 p.m. here. I would like to pass the mic to Yelena.
Yes, thank you, Charlie. My name is Yelena. I am currently serving as the vice president of the coalition. I am based in Serbia, and I'm currently in the process of finishing my pharmacy studies. I've been with the coalition from the very early days, so thank you everyone for joining. Maybe she can go next.
Thank you. Hello, everyone. I'm Shakin. Now I'm in Argentina, and I find this workshop is really interesting to know about Julia's personal journey in global health. And yeah. Thank you, guys. I'm gonna pass this to Kyle.
Great.
Hi everyone, my name's Kale. I am currently based in Germany, but I'm originally from Australia and more recently from Ireland. I've been in CGHI since 2021. I'm part of the alumni now, but I used to be the community coordinator. I work in environmental public health at the moment. Yep, great to be here today. Thanks for having me. I will pass over to Matilda.
Hi everyone, my name is Mutile. I'm from Nairobi in Kenya. I am the community lead at CGHI and I've been part of CGHI since 2022. And I work at the intersection of health and climate change and planetary health. And I think I'll pass to Aisha.
Hi everyone, my name is Aisha. I'm based in Canada, so I recently graduated with a master's in health and aging, and I'm just looking to get my foot in the door into global health, so really excited about today's talk. And I'll pass it to, is it Sarah or Sarah?
I cannot hear you.
Yeah. It's okay if there is, I think if there is a malfunction with the microphone, I think, or whoever isn't able to talk can just write in the chat.
Yeah, or you can connect and reconnect your Bluetooth or your headset. So who else? Eli or Ellie? I don't know how to pronounce your name. If you're ready, would you like to introduce yourself?
Hi, I'm Ali. I'm working at the National Dementia Strategy in Berlin, and I'm looking forward to this workshop. Thank you.
Thank you. Sarah, would you like to try again?
Yeah, can you hear me
Yes.
now?
Yes.
Oh, okay, perfect. Awesome. So I was saying that you can either say Sarah or Sarah, because I'm from France, so that's usually how you pronounce it. But I take both, no problem. So I'm a physician from France, and I'm also doing a master in global health in Lyon. So I'm very, very excited about today's workshop.
Thank you. Thank you. Brianna, I'm sorry, I mispronounced your name. So we just did a quick introduction round. So if you're ready, would you like to introduce yourself?
Sure. Hi, everyone. My name is Brianna Chang, and I am originally from the United States. Currently, I am working in the Dominican Republic to help open up a surgical center and primary care clinic for those in need. And I will be going back to school to get my master's in public health administration and policy in September. So I'm super excited to be here and listen to you guys all.
Thank you. Thank you very much. So the only one who hasn't introduced herself is Julia right now. So I wonder if Julia wants to introduce herself right now, or if Yelena would like to, who is our host and moderator today, if Yelena wants to introduce Julia or Julia wants to introduce herself.
I think I can start by reading Julia's short bio, and then Julia can really help us get to know her with her talk. So
Yes.
as Charlie mentioned, this episode is a part of the Young Professional series, and the Young Professional series is something we have only recently begun at CGHI. And the purpose of it is actually to get to know the early career professionals just starting in global health. We are learning their paths, their careers. We're trying to learn what skills they need to get into that field. So basically, it is just a perfect opportunity to hear more stories about some global health professionals and maybe even be inspired to pursue a similar career. Now we have mentioned that Julia is our speaker today. And Julia is one of our co-founders and currently is an alumni advisor. She holds an MSc in global health from the University of Gothenburg and has worked on dementia policy. In this session, Julia will share how she found her way into global health, coming from a background that's maybe not so typical, it being business psychology. She will discuss some of the valuable skills and experiences for working in global health. And at the very end of the session, you will have an opportunity to ask Julia questions or maybe just have a network session. Meanwhile, while Julia speaks, feel free to ask any questions and we can read them toward the end. Julia, the floor is yours.
Thank you so much for that nice introduction. I guess now comes the long version of that as well. Yeah, I'm Julia. I'm German. I'm based in Berlin. And yeah, I was a co-founder, or I am a co-founder of CGHI since 2019 and the start of 2020 when CGHI really kicked off. So yeah, it was really fun to like build the organization, lay down the structures in itself, and then continue being a co-lead in the social media team, actually together with Yelena, which was also very fun. And as Yelena said, now I'm an alumni advisor. Yeah, but more about my background, maybe. I started off with a bachelor's in psychology and management in Dortmund, Germany, where I grew up. And yeah, I specialized in human resource management in that bachelor's and got in touch also with occupational health. I worked in the field of human resources for a while and then discovered that's not really an area I see myself in working for a longer time. So I researched what could I do next. And since I got in touch with health in an occupational setting, I was thinking I really like this. And from then, like the research brought me to global health, which I even liked more. And I continued with my master's in Gothenburg, Sweden, which I can highly recommend. It was great. Many of you have also studied global health, so maybe have similar experiences. I can just say it was a very interdisciplinary master, and it was great to learn from everyone can also do in the course. They were from so many different backgrounds. There were people also from an economic background, like myself. There were people from medical backgrounds, nurses, doctors, social science backgrounds, social workers. So yeah, it was really a good blend. Also people from so many countries and cultural backgrounds joined, a bit like CGHI, I would say, which just enriches global health. And I mean, it's global, so I think also there must be a mix of global people in a subject and setting like that. So I really enjoyed that. During my master's, I also had the opportunity to do a placement in Mozambique, where I worked with a policy think tank and the public health agency there in a province near the capital, Maputo. There I worked or learned rather from the people working in the public health agency, from the mother and infant health and immunization programs. And that was such a great experience. It was good to see all the theoretical knowledge, so to say, being put in practice, or maybe also see the realities, because in theories, it's all good, but then in real life, it's sometimes the rollout is more difficult than theory would, yeah, assume. And yeah, I'm pretty sure you all do that already, but I can really highly recommend seeking out your university's internship opportunities and volunteering opportunities, also outside universities, and also extra courses or maybe conferences to just get in touch with people. Just a side note here, I studied also one semester of gender studies within that Master of Global Health, which wasn't in the set curricula, but I was just interested, and I think it's just really interesting and great to gain also knowledge on this. And I mean, it also plays into global health. So yeah, I can highly recommend, if you have the time and interest in a certain subject, to just combine that, because global health is just so interdisciplinary. Further, after I graduated my master's in 2020, I went back to Germany to work in the German Agency for International Cooperation, GIZ. I did an internship in a program that was concerned with health financing implementation in the area of HIV/AIDS and TB. And yeah, they have lots of international internship opportunities. So if you're also, I don't know, interested in something like that, I would recommend just having a look at that website. It's not just in Germany where you have to speak German, but also internationally. And yeah, it gives great work to like learn, to get to know cross-cultural teams. And yeah, I really gained from this time there. After that time at GIZ, I moved on to work as a scientific associate at the German Center for Gerontology in Berlin. And there I worked in the monitoring and evaluation of the National Dementia Strategy. Actually, Ellie, hello, was one of my former colleagues, so I'm very happy that you had the time to join today. Yeah, my work there, the monitoring and evaluation, was very much concerned with conducting the whole monitoring process and monitoring cycle with the stakeholders of the strategy that implement the measures. I was concerned with reporting on the results of the monitoring process, and that written report was then presented to the steering group of the strategy, and concerned with the strategy In Germany, that is the Ministry of Family and the Ministry of Health. And then also further with stakeholder engagement, I was concerned with running together with my team yearly conferences to get in touch with the stakeholders and to create synergies in between the different stakeholders. And that job really taught me how to navigate a political and scientific setting, because I think doing a degree, you're very much familiar with a scientific setting and scientific writing, but political writing is still a bit different, and it took some time for me to like learn it. But yeah, it was great insights to just work in that setting and learn on the job what it really entails and what it means. Further, I really learned also a lot of project management skills. For example, well, time management. I think you need that across any jobs. That's very useful. How to communicate properly with your teammates, but also maybe with other stakeholders not in your department. And yeah, stakeholder engagement and the communication with those was also a very valuable skill this job taught me. Moving on to further skills and things that are good in order to enter the global health space is networking, and to always take opportunities to network and stay in touch with people from jobs you've worked at or you're still in, internships, conferences. I know that's not always super comfortable because, well, maybe people are shy or it's a bit high, like higher stakes to get yourself activated and talk about yourself. But it's just good to put yourself out there, and with the practice, it gets easier and easier to build your network and just exchange ideas and discuss with people. And coming back to CGHI, I think CGHI is great for that as well, because we're all like-minded people, and we can come with ideas that even maybe seem a bit crazy, but we just bounce the ideas off each other and then maybe develop them further and come out with something good. And as Charlie said, we also have this incubator type thing, sorry Charlie, which also like develops ideas further and puts them maybe into a more well-rounded case, so to say. So yeah, I highly recommend joining and following us on social media. Yeah, further again with project management, I just wanted to add there, you can learn those skills on the job, but it's also maybe an option to do a course in project management and get a certificate, because I think that also makes you potentially more attractive to future employers. There are various project management certificates, for example, Scrum Master certificate, Agile Project Management, and you can find different things and courses like that. Maybe you already do those things, but what helped me, and I really like doing that still, is to look at job advertisements, even of jobs I'm not yet qualified for, but I can see myself or I want to work towards. And I look at it and take down the skills and note them down and just see how can I acquire those skills through maybe other jobs or opportunities. Maybe my next job will make me build this one skill that I then need in the job after that. So I think it's always good to just have a rough idea what area you want to go to, and don't like collect skills like how do you say unplanned, but maybe a bit tailored to where you want to go. And yeah, just to get a feel of like what employers would want. Another thing what you could do, what I like doing as well sometimes, is to map out interesting organizations and to see what they're up to, follow their newsletters, see if there are any opportunities or sessions, webinars coming up soon, to just connect and again build your network a bit more. Then what I think is also good to build your skill set in global health is to, when you're taking a job, you should always look for opportunities to do training. So for example, in my job as scientific associate, I did trainings on moderating and hosting workshops, which I think is also very transferable to any job you're doing. Doesn't really depend on the topic. And it really shows the employer that you are interested in continuous learning, which is always great. Yeah, and one other thing I want to add is that your thesis can be also used as like a leverage to get a job. For example, I wrote my thesis on dementia strategies on state level in Germany, and I think that highly contributed also to then working as a scientific associate in the national dementia strategy. And I've heard from other friends and people that they also wrote their thesis in a similar topic where they're then working in. So if you're free to like choose what you want to write your thesis on, or you have like a topic you're really passionate about and want to work in, yeah, I think that's really good to investigate further. And yeah, the last thing is I think like we shouldn't worry at all not getting the dream job right out of university. It can be really tricky and hard, but it's great to just step by step work towards getting the job or the field you want, and see every opportunity, internship, or job you do as just like a puzzle piece you build or you put into your puzzle, and later then work in the area or field you really want to work in. I'll have to take a sip of water, and thank you for listening to my rambling. If you have any questions or things to add, yeah, I'm happy to answer here. And also, if you have any skills that you say like, oh, I think that's a really important skill one should have in global health, that'd be great to hear. Thank you.
Thank you, Julia. I think from my side, this was really insightful and such an inspiring story. I think it's, you know, sometimes it really resonated with me. It's easy to think that your first job will be your dream job, but I love how you put it in the perspective of a puzzle, like how collecting those skills on the way will really lead you to having that dream job one day. So I really love how you put that into perspective. I also think that all the skills that you mentioned are very, very important, and they're very transferable in terms of like other fields, even if like one is not really working into dementia policy. I think they're very, very useful. So thank you for sharing those with us. I think we already have one question from Kale. I will read that out and then maybe you can answer it. He said, I'd be interested to hear about how you can build communication skills during your experiences and how important they have been for you.
Yeah, thank you for the question. I think communication is always there. It always happens. And I think it's important to learn a few things about it in your way. I mean, I'm sure every one of you also have made tons of experiences with communication. I think learning on jobs and opportunities is the biggest way to acquire it, and putting yourself out there, like to take opportunities. For example, when it comes to public speaking, that's just a small field of communication, but that can be daunting. And I think it's just good to expose yourself and be kind to yourself also, to just like acquire that skill more, because the more we do it, the easier it gets, the better we get at it. So I would say like take an opportunity as one thing, and tailored to my experience, maybe I can say, for example, stakeholder engagement and communication with actors of this strategy, the dementia strategy I worked in. It's a specific setting. It's very political, so I think political communication can be quite tricky sometimes. I love observing and then trying to maybe fit into the environment, because let's be honest, you're joining an environment and there's already like a set tone or set like how you do things. So I think it's great to adjust to that and learn from that. Yeah, and try to maybe talk to someone senior of you to like get guidance, get a mentor if you can.
Yes, Charlie, go ahead.
So I actually have a few questions for you, Leah. I wonder, I know that you said we shouldn't aim for the dream job, right? I think but when we started studying and also when we started working, we have a vision, right? We have something that we want to work towards. There's a role that we want to take on. So I wonder, what was your dream job when you started studying global health? And how did your idea of dream job change in the course of your career? And one last question, how did your understanding of global health change and evolve after working in the field? Thank you.
These are such good questions. Okay, I'll try to start with the first one. I think we do all like have maybe a dream job. I'm just thinking that we can't expect to like have it right after graduating university. And of course, we have to have a passion to get ourselves going, to keep being motivated and so on. I never had a dream job, unlike a lot of other people I studied with. And I must say, I was always thinking like, oh, I should have like a passion, that like one topic that really fires me up, so to say, and motivates me. But I was just always very driven in like learning more and understanding the world, so to say, because I feel like global health has so many facets. I think health, maybe the health aspect was like the really motivating one. And I love having topics in an international setting, and then just learning what opportunities arise. Because coming from a non-medical background, I thought, ooh, this medical world, and I thought global health is very medical at that point. It's just such a mystery to me. So just learning about it and seeing where I could fit in and find my place in this would be great. So that's what I started off with. And yeah, I think it's good to be also a bit opportunistic. So if you get given opportunity and you gain expertise in an area where, like I was given the opportunity to work in dementia policy and enter this kind of health policy area, which I enjoy. I think it's nice, and I would like to go further with that, but also maybe combine it with other topics. I'm very interested in climate change and dementia. I think that's an upcoming topic I would like to dedicate a bit more time to. And so I think maybe there are people who have like a set goal to work towards. That is really great. I wish I had that, but for me, I think I just bounce a bit and just see what I like, how I can combine things. And maybe, yeah, some of you can identify with that as well. Thanks.
Okay, do we maybe have more questions? Aisha, I see that you've raised your hand, so go ahead.
Hi, Leah. Thank you again for the informative talk. So I guess for me, my question is, what were some of the challenges you faced and how did you overcome them? And also, you did mention an internship. If you could share the information about that, that would be great too.
You mean the internship at GIZ?
Yes.
I can look for the website where they post their positions.
Okay, perfect.
In a second, or maybe we can put that out in another channel on CGHI or something like that. Challenges. Well, I found the pandemic actually quite challenging because I graduated in summer 2020 And to be honest, I was like, how to get a job on Earth without like, I don't know, going to another city, like going for an interview in person. I mean, we were like just starting to have this like digital webinars and all of this. But I did want an internship at GIZ. I looked at that already before graduating. So I applied to some and I didn't get it. And yeah, I was really, I don't know, that didn't feel nice. I mean, I'm sure you've already, everyone has been like turned down one way or the other. And so I started like writing also to them, like, oh, can you just give me maybe some reasons why this didn't happen? And actually, this is also something I would really recommend doing. And one of the interviewers was such a nice person, and she said, let's have a little talk. So we did have a talk after, and she was very encouraging and saying like, oh, listen, this and that, maybe you could focus on next time, but please do apply again. So that's what I did. I applied again, and then half a year later, I did get the internship. So I think it's worth it to, if you really want something, sometimes plans change, that's okay as well. But if you really are interested in something, it's worth to give it another try. And yeah, not just in this occasion, but also in other occasions where I was turned down for a job. I did have a really nice and informative chat after with the people who interviewed me, and really highly, highly recommend to do that. Thanks for the question.
Do we maybe have some more questions? If not, maybe I can quickly jump in with one. I know that you've mentioned, obviously, that you're coming from a non-medical background, but you have mentioned something that is very interesting to me, and that is that somewhere like after your studies at University of Gothenburg, you mentioned that you had a short period of time where you traveled to study at Mozambique, right? Would you say that those types of studying, like learning firsthand, teaches you like some lessons that are valuable later on? And how would you say that maybe some of the lessons you learned there, how did you use them later on in your career?
That's very good, a good question. So yeah, this internship was still within my master's, so it's like one course, so to say, an internship course. And I think it really, like, I learned so many skills from the people there because they knew the setting best. They just knew how to like roll out these like programs. And yeah, me coming in from Sweden as a white person in Mozambique, I think, yeah, that is difficult structure in itself. Charlie's the expert on this. I think you're researching topics like that, aren't you? So I think it really gave me also kind of understanding to just sit back and learn from the people there because they are the experts. And I think if you do want to work in the global health sphere, you always need to take that with you. And I think it hasn't left me since until now. But of course, there's always more to learn. And yeah, I'm happy to learn more and be very curious to learn more from so many amazing people doing amazing health work all around the world. Did I forget part of the question?
Well, I think you have already kind of given me a glimpse, but I was really wondering, like, how did you maybe learn some lessons that you applied later on? Like, obviously, functioning in such a different environment, like that is a lesson to be learned. But did you maybe have some like skills that you gained there that were really valuable for you later on, like while working on dementia policy or something like that?
So scientifically, me and my colleague, we wrote a research protocol, and I've never done that before, so that was really good because I think it is kind of a paper, but I thought the structure was very different. So I think just gaining more experience in academic writing, that definitely helped. Also coming into working with a dementia strategy in Germany, where I had to like pair scientific writing with political writing. Definitely, I think that's one takeaway from there.
Awesome. Yes, Charlie, go ahead.
Oh, you're still muted, Charlie.
Sorry. So I still have one more question. I just thought about it, just came to my mind. I think a lot of us don't have a degree in global health. We studied other studies, and but you know, global health is such a broad topic, and it's very interdisciplinary, and it also needs expertise from different fields, right? So I want to ask, in your experience working, the people you interact with in global health, what disciplines do they come from, and what kind of, you know, different insights they bring to the discussion from your perspective? Yes. Thank you.
Thank you. So yeah, I think, well, at least studying in my global health masters, there were a lot of medical people, and as I've said before, I thought, what do I have to offer with a kind of economic background in a kind of a medical topic? But then again, as you say, it's not that medical, and I think it is just good to bring in other perspectives. Well, from an economic point, I think it's great because our world, if we like it or not, is functioning with money. So I think having an economic lens on this just helps to realize certain projects and yeah, put them into life. And what else? That's actually the main thing I can think of, but maybe there's someone else here in the meeting that wants to share maybe their background and how they see themselves contributing.
I can share my thoughts. I thought like maybe like, for example, a sociologist who is, for example, focusing on gender studies, they bring a perspective when they look at policies, then they're more sensitive towards like how a policy or current policies are marginalizing women, for example. And also I think, because I also did gender studies, I think someone from a gender studies perspective, then they're also more sensitive to the intersectionality of different just socio-economic positions of ourselves and of communities. So then we need such lenses, analytical lenses, to look at the policies. Yeah, and also I'm a political scientist, so then we also need to look at like how local politics play a part, and also international relations play a part, like the international organizations, how their politics are also affecting the policy outcome, the implementation, the decision making, right? Who are marginalized. So I think, I mean, I believe like global health is for everyone, and I hope more people get into the field and not to feel like we didn't specifically major in global health and we cannot start learning with our, you know, different jobs within the field. So yeah, I just want to share that. Yeah, back to you guys.
Thank you. Just to also hop onto that, I also think like, sure, a degree in a certain topic sets you off maybe in a direction, but I think like the longer you gain experiences and the longer you're also away from graduating, the more you build your profile and skills, and that does count a lot. And if you're striving to work in global health, as Charlie said, there are just so many opportunities for so many also different skills within like monitoring evaluation, for example, you can do in global health, and you can do also in another other topics. So it's great to just also have those skills, hold them, and then if you're interested in global health, go into this direction. Did I see a question coming in? I can't see the chat right now.
I'm not sure what happened, but we can hear you, and I think everything is okay. I will once again invite anyone who maybe has a question to ask or even share their thought about the conversation, about what Julia said. Maybe they can even share some of the takeaways or comments or what they've learned. So yeah, pretty much feel free to jump in at any point. Yes, Sarah, go ahead.
Yeah, I just wanted to add a bit more to the topic of whether, or I mean, it's not a question, it's global health is really for everyone. And I come from a medical background, but I don't feel like it's a medical, like restricted for only medical people or from medical background. And we are 12 in my master class this year, and we have like 3 doctors tops and the rest of the master class. And it's very interesting because we have mathematicians, we have sociologists, we have people with political background, and we have like people with biomedical scientific background, and we have very interesting discussions every time, because it feels like global health can really like encapsulate all of that and really brings forward something that people from one branch could not possibly achieve. And this is why I feel like everyone has their place in global health, because everyone is affected by health, everyone is affected by global issues. And of course, these two combined together, it's really something for everyone.
That is such an amazing point. I really like whenever we have discussions on any topic, I feel like that is one of the many things that brings us together. And that is the fact that global health really is a field for everyone. And only together, I think we can achieve and make a difference. So it's great to hear that no matter like which country we are from or what kind of a background we have, we're always somehow finding new ways to each other, and we always find a way to discuss new ideas, try to bring innovative solutions to some of the problems. And I think that's like the only way that we can really achieve. So to see that we are like in different places of this one earth, we are kind of having this collaboration of different fields is so inspiring to hear. And I think that's one way to achieve great things in the future. Yeah. Do we may have some more thoughts? I think we do not. If we do not, I will slowly start wrapping up this meeting. I want to thank Julia for taking time and offering such valuable lessons. I think that I can say that all of us have learned something new that maybe we haven't known before. Or if anything else, I do believe that all of us will be more inspired once we leave this meeting. So thank you for taking time to share your path, your career, your journey, your skills, everything that you've learned along the way with us. We were so glad to have this session with you. Obviously, since it was recorded, we will distribute the link once the whole event is up on our YouTube. We will share it on our social media. Charlie has shared the links to our social media channels a while ago. And even if you do not, if you did not get the chance to write them down or copy them, I think you can always find us on our website. You can write to us. If you're not a part of CGHI, we invite you to join. We're always looking for new people, new expertise, new stories to tell. So I really hope that you enjoyed this session with us. We will be having more sessions soon. And even if you know a colleague or you yourself are interested in sharing your journey, feel free to contact us. We're always looking for sharing new stories, having new productive discussions. So yes, thank you for joining us. We were really happy to have you here.
Thank you so much for joining and listening to my journey. And I also wanted to just say, if someone wants to connect on LinkedIn or has further questions or points, I'll be happy to connect there if you like. Thank you.
Thank you, everyone. Bye. See you soon.
Thanks.
Thank you.
Bye.
Bye.